Good morning, friend. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give the valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, so we have been discussing about the height problem in a very short, superficially. And today we will discuss how to manage the parents when they come to you with the complaint that my child is not increasing his height. Now, many times we don't have a proper idea that what has to be told to the parents in such condition. Many times we will give some of the false assurance to them, which is medically not good and also not ethical. We need to tell them the exact facts. Now, one thing is what we have to say. Number one is you have to make it very clear about constitutional delay. If the child is having constitutional delay where the chronological age and bone age is less than the chronological age, and if all the other family members also give the similar type of history that they attain the height in the last part of the puberty, then definitely same can be the case with this kid also, and you have to make this point very clear. Your kid will going to attain the height once he started with the secondary sexual characteristics, puberty. Naturally he will going to gain the height there. So this is called constitutional delay. But if the case is familial short stature, parents' height is less, father's height is also less, mother's height is also less, all the family members are also having short stature and short body. In that time, gaining the height is quite impossible. Doing any magic is quite impossible because it is genetically determined trait. So there you have to tell them and maintain the growth chart and make them understand that how much height he can attain at the end of the 18th year by using the mid-parental formula and also by showing the growth chart. Now, certain things which can be done to increase the height from the beginning itself is you have to identify the growth spurt. Identify the growth spurt, that is very, very important. One is in the fetal stage, yes, 50 centimeter usually attain, and afterwards in the first year and second year, it is also a period of growth spurt. Height increases, weight increases. Height is increased up to almost all 40 centimeter in 2 years. See, this is one of the potential area we can try to do some of the things. Now, you can ask a 1-year-old boy what we can do, or a 2-year-old. Now, here what we have to do is good nutrition. In the first year of the life, second year of the life, provide the child with a good nutrition, and once the child start walking, and give some, that means walking exercise, may keep him active, don't keep him confined to the things, and do some of the stretching activities. Stretching activities means not baby will not do it, mother can do some of the stretching activities like the folding of the legs and all those things. Usually in the Flocor area, in the village area, the dais, they used to do that while they are massaging the baby. So they do so many body maneuver like bending the baby, stretching the baby, or folding the limbs, etc. So these are quite common because this is one area where growth spurt is increasing. So probably bone will be also get stretched in that moment, and ossification centers are get stimulated, and those ossification centers which are active in that particular period, so may have some good benefit. This is one thing. Number two is nutrition. Now, rickets is one of the most common problem for this short stature, as we know in Indian scenario. Rickets is a disease of the early infancy. Now, you are not exposing the baby to the sunlight, and baby is not getting the vitamin D supplementation. That is also one of the major cause where bone length is greatly affected. So we have to tackle during the time of the growth spurt. Therefore, Ayurveda explains about Suryodaya Darshana Samskara, where after 1 month baby has to be continuously or periodically exposed to the sunlight daily. So that means you have to tackle during the time of the growth spurt. One growth spurt in the early part of the infancy, that means in the infancy, Uh, and another growth spurt is during the preschool period. So there also, in the preschool period, now the child is almost active, he started walking. Now here only we have to give some of the exercise to the baby. Okay, maybe cycling, or maybe skipping like exercises, or involve him in some of the activities. Don't make him confined to one particular area by giving the mobile. So suddenly when you want, the height will not be increased. It is a very systematic process. If you really want to increase the height of the baby, it should be started from the beginning itself. You have to tackle during the period of growth spurt. Second growth spurt is in the preschool period, where child increases the height. There also you have to give some of the nutritional supplements and as well as exercises. Nutritional supplement may be in the form of the calcium, in the form of the vitamin D, and some other Ayurveda medications like Asti Poshak and Asti Shrinkal, and so many other Rasayana and as well as Balya and Jivaniya drugs. Another growth spurt comes during the high school period, usually 8, 9, 10, or maybe 9, 10 years. So there also child should be involved in so many dancing activities. Okay, dancing is also one of the very important idea to increase the height. Okay, sports activities, maybe gymnastic, okay, skipping, and some other swimming, etc. Because now the child is a 9, 10-year-old, so he can do all these things. So this is the third growth spurt where you have to tackle. How you have to tackle? Tackle by exercise, tackle by stretching exercise, tackle by the outdoor playing, etc. Now come to the last one. Okay, so last growth spurt is during the puberty. Now there is a difference: puberty in female and puberty in male. In females, the growth spurt will be there before menarche. Menarche may be at the age of 13 or 14 years. Then therefore, the growth spurt will be there 11, 12 years. So that means the females, they gain the weight before menarche. So what you have to tackle is, before menarche only you have to do this all the exercise. Then only nutrition supplement, exercise, stretching exercise, and outdoor activities you have to do. Then only it is possible. Once the menarche is over, the height gain is quite less. There is gain is there, but height will gain, but it is less. So this we have to keep in mind. Whereas in case of male, it is not like that. After spermatogenesis, the growth spurt comes. Okay, so even after the mustache are appearing, and then beard is appearing, and facial hair is appearing, then the growth spurt start. So male child will have a lot of chance to increase the height in the later part of the adolescence also. Up to 18 years or 19 years, he can gain the height. But this is not possible in case of the female. So this point has to be kept in mind. Therefore, the average height gain is more in case of male compared to the females. So whatever you want to tackle in case of female, it should be before menarche. After adinarche, before menarche. But in case of male, starting from the puberty period up to the last 18 and 19 years also, you have got a chance of increasing the height. Then comes ossification center. Now different ossification centers are there, and their active time is different in different bones. For example, in femur, in tibia, in humerus, ulna, there are so many, and even the clavicle and vertical bones, vertebral bones, pelvis, etc. There are so many ossification centers are there. Their timing is different. Okay, now suppose the femur ossification centers are active probably in maybe 8 or 9 years. So that time you have to give more exercise for the femur bone. Okay, so then it will be more beneficial. So ossification centers are the points from where actually the growth of the bone start. Epiphyseal, they are present in the epiphyseal end, they become active, and then the changes start, and the bone length will going to increase. So understand where actually the ossification centers are active, and accordingly you have to give the medication, or sorry, exercise, medication, etc. Now talking about the certain drugs. Now certain drugs will have the adverse effects on the height, especially the steroid and some other immunosuppressive drugs, etc. So they will block the ossification center. Once the ossification center is blocked, then epiphyseal end will not be active, and the bone length will not happen. So this is actually the problem in case of nephrotic syndrome and so many other syndromic babies, where ossification centers are get blocked at the earlier. As a result, the average height gained is very less because ossification centers are closer earlier, especially in case of steroids. Now talking about some of the medications in Ayurveda. Now there are a lot of people, they are telling about the medications for the increase in the height. Many of the time constitutional growth delay when it is there, So patient will going to gain the height naturally according to the genetic trait, and at the end of the 18th or 19th year, he will be getting the target height. There is no medicine required, only nutrition, exercise is required. But our familial short stature, I already explained the limitations. Pathological short stature, I already explained we have to treat the underlying cause. Endocrinal, also we have to give the hormonal supplementation if it is required. Now, some of the medications which is commonly used in our science, Ayurveda, is some of the Jivaniya, Brahmaniya, Balya drugs, and even the Rasayana drugs. So they can be used. But identification of the growth spurt is very important. We have to give maximum stress during the growth period. Now, commonly used some medications, for example, Chandrashura Bija is used, Rohitaka Thok is used, then Ashwagandha, Shatavari and Vidarigandha and some other Balya drugs can be commonly used. But more than the drugs, what I mean to say is it's nutrition, it is very important. It is exercise which is important, outdoor activities which is important, stretching activities, stretching bone, because when the stretching is there, bone is stretched and the bones are stretched, ossification centers become more and more active, that process will be enhanced and the possibility of a height gain is there. Okay, so nutritional supplement is very important and activity is important. More important, height gain process of the effort, it should not be started at the end part, like after the menarche. After the menarche, you come to know that height is not gained, and then you started with all the effort. This is not a good one. From the beginning itself, you have to plan this. From the beginning itself, if you adopt this type of the approach, then naturally he will gain the weight, except the familial short stature. Even in the familial short stature also, certain centimeters of height can be gained if you adopt this particular method. So this is all about short stature and this burning problem. My child is not gaining the height. It should be tackled very, very systematically and with all common sense and ethical sense. Thank you very much.